Today is National Fentanyl Awareness Day, and we now continue our morning-long discussion on the ongoing fentanyl crisis here in the Valley.
Right now, we have Fresno County District Attorney Lisa Smittcamp. Thank you so much for joining us this morning.
Thank you for having me.
What is it that parents are watching right now? What do they need to know about this situation with fentanyl?
So I think the most important thing that parents need to know is that this can affect your child. So many of us who have, productive kids who are good students and athletes and musicians, and they have whatever activities that they do, and they're fairly good kids. They think that they're immune from it, and actually that's the population of kids that we're seeing is most affected by fentanyl. So I think the most important thing that you can do is educate yourself first, and then start talking to your kids about it.
Social media comes into play here. Why is it important for parents to know which social media apps kids have on their phones, and what's the effect there?
So teenagers don't communicate in the old-fashioned way like we did. They don't call each other. They don't stop by each other's houses and say, "Do you want to hang out? Do you want to go out?" They don't do that. They started with texting, and now it's really moved into other social media formats where they communicate with direct messaging and other things. And so even though all of that technology is super exciting and sometimes can be used for a lot of good, it can also be used for really bad things. And that's what happens. So people who are selling fentanyl are using social media apps like Snapchat to advertise it and to sell it and to get access to other kids who might want to try it or who are using it. And so all of those, and that Snapchat stuff, it disappears, right? So you can see it for a minute, make arrangements for a transaction, and then it disappears and there's no record of it. So that's what they do. And then they use cash apps like Cash App and different types of cash transaction applications to transfer money back and forth. And that's why there's no getting in the car and driving to make your connect anymore. There's no going into seedy neighborhoods anymore. Sometimes they just meet at a local restaurant, at a corner, at a gas station, and that's where it happens. And sometimes even during COVID, we were seeing dealers actually dropping it off at people's houses.
Oh, wow.
So it's very easily accessible. They come in small pills, so it's very easy to hide, and it happens right under really good parents. It happens right under their nose.
So anything you have in your head from the past about this is how a drug exchange goes, these are the warning signs, it's not here with this.
No,
and they also lace different kind of pills, right? You don't even know there's fentanyl in some of these.
Right. So the opioid crisis has been a thing in the United States for a very long time. We are 4% of the population in the world, and we consume over 85% of the opioids. So the opioid thing has been there for a long time. And the drug cartels have really just sort of capitalized on that, and they've started putting trace amounts of fentanyl in these pills. And so they do come mostly in the blue pill form, which is the M30, which mimics like a Percocet. But we also see it in Vicodin and Xanax. A lot of teenagers used Xanax and are using Xanax for anxiety. That's lawfully prescribed by doctors, and then when those prescriptions end, sometimes they're addicted, and sometimes they just like the way it feels, so they resort to buying it on the street. And then that's when they get into the whole issue of fentanyl-laced pills. So yeah, comes in all different forms.
So the ones that you just mentioned, they're called fentanyls. Is that right? Is that a term they use?
No, they're called all kinds of things.
Okay.
They're called. They say M30, which is a brand, so it has an M on one side and a 30 on the other. But they call them blues and perks, and they have all kinds of street names for them. And they call them Xanny bars when they're buying Xanax bars. And the kids have, there's 100 names for them. So, and sometimes kids get involved in fentanyl and they know it, and then sometimes they get exposed to it when they don't know it, and then they become addicted. But they're, teenagers are teenagers. They're experimental. We were all reckless as teenagers. That's part of growing up, but it's part of being a teenager. Today, what's different is the risks that they are taking could be fatal.
So yeah, let's talk about that a little bit here. Like some of these overdoses or even just small exposures when people don't even know. We've had stories about even officers where they've gotten a small exposure and all of a sudden they're in the hospital and they're fighting for their life. Can you talk about maybe what parents should know that what they could experience?
Yeah, it's really Russian roulette, and we've worked very hard on this education and awareness campaign. And we actually talked with the people who do our ads and our awareness campaign, and we thought about using that Russian roulette theme, but it did not play well with kids. They didn't understand what it meant. And, you know, with teenagers, I even showed a little pilot piece to my own children, and they were like, "I don't understand, Mom. What does that mean? If you do this, you might commit suicide?" Because, you know, we had a gun, putting the pill in, and sort of trying to make that analogy, and it just didn't fly with the kids that we tested it with.
Oh.
But that's really what it is, and I think that's an analogy that parents can understand. Is that every pill could be a different reaction for you. Every pill could be, you know, we could take the same pill that with the same amount of fentanyl, it may affect you differently than it affects me. So it's because fentanyl is like alcohol, you can build a resistance to it. So there's 100 different factors that go into play, and that's why we're really pushing the just don't use it. You know, there's all sectors, as you've seen, you know, covering this morning. From the health department to addictive services, and then also law enforcement, and we're all sort of trying to attack it in a different way so that, you know, we can stop people from using it and help people that have been addicted.
All right. That's the Fresno County District Attorney, Lisa Smittcamp. Thank you so much for joining us.
You're most welcome.
This
Thank you
morning.
for doing this.
All right. If you or someone you know needs help, whether it's from mental health services or substance use disorder services, call the number there on your screen. It's 1-800-654-3937. There are real live people there available to talk to you now.